In this video, we will learn about all the muscles of lower limb with their nerve supply with the help of mnemonics, which will be very useful for you a day before exam or to revise whole of the lower limb in just few minutes. Seeing the muscles of the gluteal region. The muscles of the gluteal region are gluteus maximus, gluteus medius, and gluteus minimus. We also have tensor fascia lata and piriformis. Piriformis is the key muscle of the gluteal region. Seeing the nerve supply, gluteus maximus is innervated by inferior gluteal nerve, whereas gluteus medius, gluteus minimus, and tensor fascia lata, all of these three muscles are innervated by one nerve, that is superior gluteal nerve. The piriformis, which is the key muscle, has different nerve supply, that is ventral rami of S2 and S3. The other muscles of the gluteal region are superior gemellus, inferior gemellus, obturator internus, obturator externus, and quadratus femoris. You may see that I have written muscles in somewhat jumbled way because superior gemellus is paired with obturator internus because of their nerve supply, as both of them are supplied by nerve to obturator internus, as obturator internus muscle is included. Similarly, inferior gemellus is paired up with quadratus femoris because both the muscles are innervated by nerve to quadratus femoris. And obturator externus, which is left alone, is supplied by posterior division of obturator nerve. Seeing the muscles of the thigh are divided into three compartments. The muscles present in the front of the thigh are sartorius, quadriceps femoris, and articularis sternum. All of these three muscles are innervated by femoral nerve. If you want to see all the muscles in 3D of gluteal region as well as thigh, I have given the link in the description box where you can go and check out the video. Moving on to the muscles present in the medial side of the thigh. We can learn it with the help of mnemonic GAP, where G stands for gracilis, A stands for adductor longus, and another A for adductor brevis, and P for pectineus. And all the muscles of the medial side of the thigh are innervated by obturator nerve. The muscles present in the back of the thigh can be learned with the help of mnemonic BASE, which stands for biceps femoris, adductor magnus, semitendinosus, and semimembranosus. And all the muscles present in the back of the thigh are innervated by tibial part of sciatic nerve. But biceps femoris has one long head and short head. The long head is innervated by tibial part of sciatic nerve, but the short head is innervated by common peroneal part of sciatic nerve. The adductor magnus similarly have adductor path and hamstring part. The adductor part is innervated by posterior division of obturator nerve, whereas hamstring part is innervated by tibial part of sciatic nerve. Revising all the nerve supply again, the muscles of the front of the thigh are supplied by femoral nerve, whereas muscles present on the medial side of the thigh are supplied by obturator nerve, and muscles present on the back of the thigh are supplied by tibial part of sciatic nerve. Now, I would like you to solve one of the MCQ. Which muscle is not supplied by obturator nerve? And the correct answer is hamstring part of adductor magnus muscle. Keep up your energy because we are left with only the muscles of the leg and sole muscles. Moving on to the muscles of leg. The muscles of leg, like the muscles of thigh, are also divided into some of the compartments. Seeing the muscles present in the anterior compartment, that is in the front of the leg, they are tibialis anterior, externor hallucis longus, and extensor digitorum longus. We have peroneus tertius and extensor digitorum brevis. All of these 5 muscles present in the anterior compartment of leg are supplied by deep peroneal nerve. How we will remember peroneal? We have the muscle peroneus tertius, which correlates somewhat with the peroneal nerve. Moving on to the muscles present on the dorsum of the foot. The dorsum of the foot muscles are also known as peroneal muscles because it has peroneus longus and peroneus brevis. And both of these muscles are supplied by superficial peroneal nerve. Moving on to the muscles on the posterior compartment of leg. The muscles on the back of the leg are divided into superficial and deep. The superficial muscles include gastrocnemius, soleus, and plantaris, whereas deep muscles include popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior, whereas tibialis anterior is present on the anterior side of the leg. And all the muscles, that is superficial and deep muscles, on the posterior side of the leg are supplied by tibial nerve. I would like you to solve again one of the MCQ. Which muscle is not supplied by superficial peroneal nerve? And the correct answer is peroneus tertius. Revising all the nerve supply of the leg muscles again. The muscles on the anterior compartment of leg are innervated by deep peroneal nerve. Muscles on the dorsum of the foot are innervated by superficial peroneal nerve, whereas muscles present on the posterior side of the leg are innervated by tibial nerve. And here we go with the last part, that is muscles of sole. The muscles of sole are divided into 4 layers, and each layer has specifically 2 to 3 or more than 8 muscles. But don't worry, it will be very easy for you to remember if you know how to write them. And the main thing to learn all of these muscles is to write them in a very sorted manner and with the help of different colors. The first layer will include flexor digitorum brevis, abductor hallucis, and abductor digiti minimi. These 3 muscles are included in first layer. Before seeing the muscles of the second layer, I would like you to see the muscles of the third layer. We will write adjacent to first layer the muscles of third layer. In first layer we had flexor digitorum brevis. Similarly, in third layer we have flexor hallucis brevis. There is a difference in D and H. In the first layer we had abductor hallucis. Similarly, in the third layer we will have adductor hallucis. And in the first layer we had digiti minimi. It was abductor digiti minimi. Similarly, in the third layer we will also have the word digiti minimi, but the muscle will be flexor digiti minimi brevis. Moving on to the muscles of the second layer. In the second layer, we have the muscles like flexor digitorum accessorius, lumbricals which are 4 in number, that is lumbrical 1, 2, 3 and 4. Then we have flexor digitorum longus and flexor hallucis longus. You may think that we have learned these muscles in leg. Yeah, but they are present in sole too, in the form of the tendon. Similarly, we will compare it with the muscles of the fourth layer. In the fourth layer, instead of flexor digitorum accessorius and lumbricals, we will have plantar interossei and dorsal interossei. Plantar interossei will be 3 in number, and dorsal interossei is just adjacent to lumbricals. Hence, they will be 4 in number. In the second layer, we saw the tendons of the FDL and FHL. Similarly, in the fourth layer, we will not have some new muscles. We will have the tendons of some of the muscles of leg. And that muscles will be tibialis posterior and peroneus longus. This is how you will compare all the muscles of each layer and remember it very easily. Moving on to the colors. I said that we need to write the muscles specifically in different colors because in this whole chart you can see that some muscles are specifically written in blue. The muscles which are written in blue color are supplied by different nerves, whereas all the muscles which are written in different colors are supplied by only one nerve, that is lateral plantar nerve. Hence, here we have the conclusion that all the muscles of the sole are supplied by lateral plantar nerve, but we have some of the exceptions, and that exceptions include flexor digitorum brevis, abductor hallucis. In lumbricals specifically, we have the first lumbrical, and then we have flexor hallucis brevis. All these 4 muscles are supplied by medial plantar nerve. Hence, I have written them in different color, that is blue. Also, we saw some of the tendons of some of the muscles of the leg, and the tendon of FDL, FHL and tibialis posterior are supplied by tibial nerve, and the tendon of peroneus longus is supplied by superficial peroneal nerve. Hope this chart was very helpful for you. Thank you so much for watching this video. Please do like, share and subscribe.